Six concepts and standard views. Transthoracic echocardiography is the most commonly performed non-invasive investigation in cardiology practice. It can be performed quickly at the bedside and can evaluate left and right ventricular systolic and diastolic functions, valvular heart disease, and disease of the aorta and pericardium. There are several strengths and limitations of the echocardiography. Echocardiography has four main windows: Parasternal window, Apical windows, Subcostal, and Suprasternal window. Each of them are divided into sub-windows. Long axis view. It is usually the first view obtained in a routine transthoracic echocardiogram. The patient is best imaged lying on his left side within left arm under the head. Place the probe in third or fourth intercostal space just left of the sternum with the indicator marker pointing toward the patient's right shoulder on 11 o'clock. Minor adjustment in probe position, tilt, and rotations are often needed to align with the heart long axis for optimal visualizations of the left ventricle, aortic valve, and mitral valve. This view is used for the measurement of left ventricle aortic root dimensions and is also used for 2D mode assessment of the ventricles, mitral valve, and aortic valve and the pericardial disease. Parasternal short axis view. Short axis views are made from rotating the probe by 90 degrees toward the chin from the right shoulder and from 11 o'clock to 12 o'clock. Short axis views usually for different views. Mitral level. In this level, you see the mitral valve and calculate the mitral valve area. A second is the pupillary level. You see the pupillary muscles here in this view, and next you will see the apical view. In all these view you can see the wall motion abnormality and also the muscular septal defects. And the last, you can see the aortic valve level. Here in this view you can see the pulmonic valve, aortic valve, and the tricuspid valve, and also see the morphology of these valves. For the apical views, you can rotate the marker point of the probe toward the 3 o'clock toward the apex. And the various views which are obtained from this position include the 4-chamber view, the 5-chamber view, 2-chamber view, and the 3-chamber view. Here you can see the 4-chamber view by the probe marker point directed toward the 3 o'clock, and you can see the 4-chamber. Here is the marker point toward the 12 o'clock and 2-chamber view are made. And now I am rotating the probe toward the right shoulder or 11 o'clock. Here you can see the 3-chamber view. In addition to assessing the LV function and wall motion abnormalities, the apical views are used to assess the flow across aortic, mitral, and tricuspid valve with the helps of Dopplers, as the flow across these valves are parallel to the direction of the ultrasound beams. Doppler is useful to assess for the degree of stenotic and regurgitation lesions. Diastolic functions is also assessed in apical views with the help of mitral inflow pattern, pulmonary veins Doppler, and mitral annular tissues Doppler. Right atrial and ventricle size and right ventricle systolic functions also assessed by the apical 4-chamber views. Subcostal views. The patient is placed in the supine position with legs in bending positions, and the marker points of the probe at 3 o'clock. As you see in the video, The marker point is toward the 3 o'clock, and you see the 4-chamber subcostal view. A 4-chamber view is obtained by scanning under the subxiphoid process. View is usually used to look for atrial septal defect or pattern for main oval. Inferior vena cava, hepatic veins, and abdominal aorta are also visualized. As you see, I rotate the marker point toward the 11 o'clock. The IVC is visualized, and other views are also obtained from the subcostal window. In suprasternal views, the patient is lying flat without anything under the head. While taking this view, the transducer is placed in the suprasternal lodge with the probe pointed at the left shoulder, as you see in this video. In this window, we see the coarctations of aorta, the diastolic flow reversals, the PDA. These things we see in the suprasternal window.